During the peak of the COVID-19 outbreak, researchers at the University of Texas followed every positive case, took that data, and gave a picture of the spread that helped hospitals prepare for an increase in patients. The UT COVID-19 Modeling Consortium is now going nationwide with a new name. Our Grace Reader sat down with Professor Ancel Meyers on what's next for the consortium.
We talked so much about the COVID-19 Modeling Consortium during the pandemic. Can you talk a little bit about what has happened with that consortium?
Since the end of the pandemic, the consortium has been hard at work trying to take the technologies that we developed, the lessons that we learned during the pandemic, and turn it into methods and software and practices that can be used by public health agencies all across the United States to prepare for future pandemics and to respond to future pandemics, the next time one emerges. We are now called EpiEngage. We're funded primarily by the CDC, and the group is based at the University of Texas at Austin in my research group, but it includes research groups around the country, in fact, around the world in different universities, and then quite a few public health agencies who are partnering with us in making sure that the tools we developed are actually going to be useful and used by them in the heat of the moment. So some of our partners include the city of Austin, the city of El Paso, the city of Houston, Dallas, San Antonio. We're working with the state of Texas, the state of Massachusetts, and we're also working with the city of New York.
Can you talk a little bit about what it is that you all are working on now? What are some of those solutions that you're trying to prepare?
Sure. So one of the things that turned out to be incredibly useful during the pandemic was having reliable short-term forecasts of how many people were going to be going into local hospitals with COVID and how many people would actually need ICU care or more critical care. And the UT Modeling Consortium, that was one of the things we did. We built models for forecasting those things. We continually improve those models, and then we put our forecasts online on dashboard so that not only could the healthcare systems and the public health agencies and the decision makers see them, but the general public could see them. They could see when things were going up, when we needed to be nervous and maybe change our behavior or just take more precautions, and also when things were going down and we could be more relaxed and get back to our life. And so Austin was really lucky to have a modeling team locally who could dedicate the time and effort to doing forecasts that really mattered at the local scale. And there are a lot of cities and states that didn't have local forecasts, and they had to rely on whatever was being put out by the CDC or other national organizations. And so what we're trying to do now is to build technology that allows us to forecast things like influenza and COVID and RSV, the things that we have to deal with every year, and not only do it in Austin, but do it, in cities all over Texas and all over the country. But we're also trying to build those tools so that they are poised and they're ready to go and can be adapted when new threats emerge that don't look like the ones that are currently circulating or that we've dealt with in the past.